Hi, my name is Chiang. I'm a physical therapist here at Foothills Sports Medicine in Tempe, and what we're going to do today is show you a couple of exercises that you can do for sciatic pain. They're going to be very easy, that you can kind of do anywhere, anytime, as long as you have a floor or a table somewhere safe that you can lie on. Alright, so for the very first exercise, this is what we call a sideline clamshell. We're going to be on your side here. What we want is we're going to bring your legs up so that it's about a 90 degrees here and 90 degrees here. Now, what we're going to be focusing and targeting is your hip. A lot of times with sciatica, you have a weak hip, and so certain muscles are working too hard and pinching on your nerve. So what we want to do here is, once I get to this 90-90 position, we're going to slide the top knee forward. So this knee is always going to be in front of that bottom knee. What's going to happen, you're going to keep the feet together, you're just going to slightly raise this up and then back down. Now when you raise this up, you want to be careful. A lot of people really like to rotate everything there. That's how you actually make your sciatica pain worse. So it's very important that you do it correct. As long as you keep this knee in front of the bottom knee, you'll never do it wrong. It's just going to be here as you raise it up, nice and slow, and you're going to come back down nice and slow. You might find that your muscles are a little weak, so when you come up and when you come back down, you might notice that your leg might shake a little bit. Your job is to try to make that as smooth as you can, and you should feel that right in your butt cheek right here. If you're not feeling it there, you're feeling it over here or in the front, you're doing the exercise wrong. Make sure that you get yourself in the right position, and you will always feel it in here. Make sure you don't push with the feet either. That's going to be the main things that you want to watch out for. So that's the very first exercise. Alright, this is the second exercise. This is what we call a posterior pelvic tilt. Now there's two ways that you can do this. This is my preferred way. Both of them will help sciatic pain. What you're going to do is you're going to be in what we call hook lying position. You're going to have a nice flat back against the table, and you're going to have your knees bent. A lot of times when people are in this position, this back is arching up. That's one thing that we want to be careful of while we're doing this exercise. What you're going to do is you're going to find a ball. It can be anywhere around this. This is about a 6-inch diameter ball. You can find a towel roll, a pillow, fold it up, and you're going to put it right between the knees. What you want to do is you want to give it a nice, gentle squeeze. I always tell people it's like having a balloon there. You want a nice squeeze. You're not going to squeeze it until it bursts, but just a nice, gentle pressure. Once you have that pressure, you should feel that muscle right between your thighs start to activate. Once those are activated, what I want you to do is you're going to rotate your hips up, but keep the back down. And you're going to come back down. What you're really going to try to use is you're going to try to squeeze your butt cheeks together to do the job. Now a lot of people don't know what that actually feels like. One thing we all do is we've always had that experience where we kind of have holding that fart. That's the idea that you want. You're going to pinch those butt cheeks together. Don't let anything leak out. A nice little rotation there, and then back down. You should feel nothing in the back. You should feel everything right to the hip, maybe a little bit to the back of the legs, but mostly in the butt cheeks there. That's going to be the primary focus. If you're feeling it in your back, you're doing it wrong. Relax a little bit. Just squeeze the butt cheeks if that's the case, and as you get stronger, then you can do a little bit of a rotation there. The other variation, if you go out and buy yourself a TheraBand, or you go see therapy and get yourself a TheraBand, they'll put it around the knees here and you can spread it out. Now this would require another individual if you're doing that home. You want someone right here pressing out, and then you're going to do the same thing. You're going to rotate that butt cheek up and then back down. So that's exercise number 2. 2 variations. Just got to make sure that you don't feel it in your back. Alright, so this is the third exercise. This is what I call a 90-90 bridge. So you're going to be at a 90 degree here and a 90 degree here. Now, a lot of times with sciatic pain, you're getting impingement of the nerve right at the butt cheek there. So what we're trying to do is correct the alignment of your pelvis. So, same idea, you're going to have a ball between the knees. You're going to get a nice little light squeeze in between there. You're going to dig your heels into the chair, and you're going to roll that hip up the same way, right up that way, and then back down. Now when you're doing that, you should feel that all the back side of your legs here. You want to make sure that your hips are coming up even. So coming back up, then hold, and then back down. Now if you feel a lot into your stomach or into your back, you're using the wrong muscles. What we're trying to do is teach you how to use these muscles instead of your back muscles, which often leads to increased sciatic pain. We're trying to stabilize your pelvis. So come back up, there we go, and then back down. Very, very simple. All you need is a chair. So lying down on the ground. If you don't have a chair, you can always do it at the end of the bed. Put your feet against the wall if you don't have a headboard. And same exact thing, put the heels in and just a nice little rotation up and a nice little rotation down. Alright? So this is another way. This is going to be a stretch. What we're trying to do is to promote the proper movement in the back. So, if you can get on your hands or your knees, if you have wrist issues, you can roll up a towel, clench it in your hand like this. That will make it less painful on your wrist. You're going to be in this position, and all you're going to do is we're going to try to get a nice flat back. You can kind of see her back right here is a little bit arched down. You'll generally find this in a lot of the females. With guys, you'll find a back that's a little bit more rounded out here. The best way to figure out where you are is drop your belly all the way down, arch your back all the way up, and then find that middle ground. That's where you want to be. And so in that position, what you're going to do is you're going to rock everything nice and back. That will give you a little relief back through here, and then you're going to come back up here. Nice and easy. Now you want to make sure that you keep this steady. Earlier on, you might not know if you're doing it right or wrong. Double check. Drop all the way down, go all the way up, find that middle. See kind of where you were compared to last time. And you're just going to rock back, and then rock back up. That's going to decrease the tension on the back here, take the tension off of your spine, take the tension off of your nerve, and things should work out all right. So this is what we call quadruped rocking. Now there's another variation that you can do on the go. It's called a modified quadruped rock, very original. Let me have you stand up, we're going to go over here. She's holding on to the edge here. She's going to rock back. She's going to push her butt cheeks back as far as you can. Nice little bend of the knee. And you should see this back get nice and flat. You'll get a nice stretch through here. That's going to decrease a lot of the compression that might be jamming up the nerves there. Make sure that you don't round out a lot. We want this to be nice and flat. You should feel tension on the hamstrings, tension in the mid-lower back right through here, and then come back up. This is something that you might already be doing. Your body inherently knows what it wants. Give it to it.